Yeah, my name is Tony Robertson, and I'm here representing the People's Health Movement for Scotland. I'm also a researcher and lecturer in social epidemiology, working on health inequalities at the University of Stirling. For this event, I'm here with the PHMS hat on. As an organisation, we were delighted to be invited to speak for our vision for the city, and the work helping to build it and the outcomes that could be achieved over the next few years. I'm going to focus on one piece of work we've done recently and use this to help frame some of the recommendations. Last year, as part of the People's Plan for the city, we held a public inquiry, similar to the format we're doing today, inviting a number of speakers to provide evidence about health inequalities in the city during the pandemic and setting forth a vision for the future. The key findings from that were that COVID, which was the focus at the time, has both exacerbated the causes and consequences of pre-existing health inequalities and also created additional threats in terms of things like social isolation, new experiences of poverty, workplace harms, and exposure to physical and emotional abuse. There are also some indications that the policy responses that have supported new ways of using outside space and active travel have worked a little bit. Within communities, there also appears to be a significant growth in mutual aid, which is a positive. But overall, it's clear that the current and past policy responses to the underlying issues which create and exacerbate conditions of inequality and impact on the social determinants of health have proved ineffectual in the city and more widely too. We did have some notable pieces of evidence that were, of course, missing around things like housing and climate and disability, which is something that we're looking to investigate further. And where recommendations were made, we tried to frame these in a manifesto, around a manifesto we created originally in 2016 and then refurbed in 2021. Some of the examples of some of the things that came out from that were suggestions that we need to strengthen policies that act on social determinants of health as a broad idea. We need to recognise that the climate emergency is a public health emergency and ensure actions to address environmental issues also address socioeconomic issues and underlying inequalities of power and opportunity. We need to increase access to affordable, high-quality healthcare in Glasgow and Scotland, which doesn't exist as we stand. We need to ensure greater diversity among political candidates by reviewing current conditions for elected members and also addressing issues that predicate against engagement from people of colour, women, and people affected by disability. We need to facilitate better public conversations about tackling inequalities, raising critical consciousness and awareness of systemic social and economic injustice. We need to have the tools like low-cost tribunals or court systems that hold our governments and other public agencies to account, especially in upholding the human right to a healthy environment. And we need to place trust in communities to understand and respond to needs and allocate appropriate resources fairly and effectively, and not just in a tokenistic way or with limited funding. Essentially, a new municipalism in the city. Many of these are, of course, goals, and they're quite broad rather than policies specifically, and often they need to be localised to Glasgow or our city. Other examples include things that we could look at, like the 15-minute city approach, about getting everyone living in a city being able to have access to essential urban services within a 15-minute walk or bike ride. Urban rewilding and greening, so creating habitats for animals, tree canopies, and even reintroducing species that have long been displaced by our roads and our buildings. Really getting into the circular economy, reducing taxes on labour and increasing taxes on pollution and resource use, both at a local and a national level. Get away from using the term net zero. For those that don't know, that's essentially where the greenhouse gas emissions minus the removal of greenhouse gases balance out to zero. But a 100 minus 100 equals zero, but so too does a 10 minus 10. So which one do you want to start with? And these issues, regardless of the ideas, it's really about implementation. I mean, policy can be a tool for good or bad, depending on how it's implemented and what changes are wanted. For whom, who decides, who implements, who benefits, and who pays. Thank you for your time.